40% of diabetics are walking around without knowing that. So you are diabetic, and that's why I started from that point. They don't even know that they are diabetics, and they would only find out accidentally. The same thing happens with hypertension and a lot of cardiac diseases. So you'd realize that sometimes someone will be walking around or go to the gym, and people will be saying, oh, he's an otherwise healthy person, and might get a cardiac event and unfortunately be hospitalized for a long time, or in worst cases, pass away.
Yeah.
But they would have had telltale symptoms, sometimes a random morning headache or something that, like I was listening to all of you at the start of the program, and Raymond was saying that a guy would only go kicking and screaming to the hospital.
Yeah.
So when they get these symptoms, they'll take some paracetamol or some ibuprofen, and as long as it knocks it off, they do not bother that what is the underlying condition that is causing me to get these headaches. So they wouldn't go and check. So all these people are walking around unknowing, and often when they get picked up accidentally, the cost to the healthcare payers is higher because they have to go sometimes straight into what we call secondary care.
Yeah.
And the cost of secondary care, which is hospitalization, often is higher than primary care, which is where you are being managed in the community. So what mass screening does is it identifies the sick healthy long before they have to have a health episode and go into secondary care. And when that happens, they can be put on what we call first-line medications for which category, ever category of disease they find themselves in, whether it's diabetes, whether it's hypertension, you name it. They can be put on the first-line medication. And often first-line medications are relatively cheaper.
Yeah.
And because they can be put on the first-line medications early, their prognosis, that is the outcomes they will get from the management of their disease, is also better. And they do not then go into secondary, tertiary line medications, which would have a hit on their payers if they don't have health insurance, or if they do have health insurance, have a hit on the health insurance payers because often those are specialist medication. So if the NHIS is able to do this and screen en masse and identify these people, some even would be identified as borderline. Borderline means they are not actually hypertensive or diabetic, but they are getting to the point where they need to be monitored.
Yeah.
Then there can be what we call a recall process to bring them in from time to time and nip the symptom in the bud the minute they cross the threshold to become a chronic disease patient. So countries that have done this, in the end, have increased their life expectancy. They have decreased the cost of their secondary care because fewer people go into hospitals. And also, they have increased the quality of life of their citizens because what we call their quality adjusted health years, that is the number of years you stay healthy compared with the number of years that you would live on this world, is higher. And therefore, they are more productive to the society by way of working longer, paying taxes, and generating wealth and all that. So if you look at it from that broad-based idea of preventative medicines, then Dr. Boaji Da Costa is spot on. The next question we go to will be, how do we operationalize it and how do we fund it? So that is where I'll leave it for now.